Surgery's finished, other than sewing it up. There's a little healing area there. So that hole there was all full of pus and bad materials. And there was chemical technology in this white material to induce stem cells of the body to turn the blood into bone-making cells called osteoblast. And osteo means bone, and blast means like to blast off or to create. So we want to blast new bone molecularly, like to trick the body molecularly to induce those cells of the body to produce bone in this hole. So that really happens. That's the amazing thing about this technology. So meaning we'll take an x-ray today, and in 6 months we'll see all that area here white on the x-ray, meaning bone growth in there. That's usually what happens. So we're going to close the tissue back. You can see very relaxed tissue, no bleeding. No bleeding whatsoever during that whole surgery. Usually they bleed a lot more. We're going to put the tissue back. See how nice, neat surgery. Virtually no tears. Put a couple stitches in and call it a day. Okay. So here's the crown in place, all cemented in. Bite together for me. Chip, chip, Coco. How's that feel for you? Did you have any discomfort when I put the crown in your mouth? The sandblasting part, that part at the beginning, was it tolerable or annoying? Or both? It was annoying and tolerable. There's no getting around the sandblasting. That stuff that we did at the beginning, we have to do that. That's it in place there. It looks absolutely beautiful. It just glistens. That's 96% as strong as metal, that crown, even though it's called zirconia. There it is there. Deepak, can you get that on the x-ray, please? Let's look at the other side where we did the surgery. We just did the surgery now too. An apico there. So the hole's up in there, back there. Tissue looks nice and pink. There's only 2 stitches in there to close the whole thing up. That's all you need. Going to put ice on her face, take some Advil, Tylenol, extra strength, Paradex rinse, no antibiotics. I'll use antibiotics. I don't think you need it. These rarely get infected afterwards. Bite together, and that's it. Also on her, I forgot about this, and we'll show the apico too afterwards. So here's the crown. You can see the interface of the neck of the very bottom of the crown with the very top of the roots there. It fits right over. It's a perfect fit. The posting core is embedded here. You can't really see it. So that's the crown there. See the contacts here, nice broad contact here. And here's the apico on the other side. See that little white whiff? That's the white part that he saw here. So this dark area here that we see here, we're going to get it whiter in about 6 months, and that material there is going to induce that osteogenesis in that area there. These are my crowns also that I've done for another 3 post and core crowns. All perfect fits also. Really nice work. Those are my root canals. Looks nice there too. So far so good.